Okay, can we
So,
start?
yes, it's just to tell me now, Mr. Ahmed, 45 years old, complain of shortness of breath, examine his cardiovascular system. Proceed, doctor.
Okay, I will enter the room, and first of all, I will clean my hand with the antiseptic, and then I will ask, I will introduce myself. I am Dr. Azhar, one of the doctor in the cardiac unit. Are you Mr. Ahmed, 45 years old?
Yes, I am.
Then, okay, now I'm here to examine your heart. Is that okay with you?
Yes, okay.
Okay, before I start examination, I will stand on the leg side of the bed, and I will have a general look. I just want to see the complexion of the patient. Is anemic or jaundice or cyanotic?
The patient is normal, no pallor, no jaundice, no anemia.
No anemia. Then I will ask him, please remove your shirt, and I want to see any scar mark over his chest.
Okay, there is no scar mark on the chest.
Any gynecomastia, enlargement of the
Nothing.
breast?
Nothing.
Nothing. Okay, Mr. Ahmed, can you cough for me?
This is cardiovascular, no need for cough.
Okay, okay. Then I will start from the pulse. First, I will check. First, I will start from the hands. In the hands,
Yes,
I will check any clubbing.
there is no clubbing.
I want to see any stigmata of the infective endocarditis, like infective, like ocellular nodes, splinter hemorrhage, Geneva lesions.
No, normal.
And there's nothing.
Mm.
Okay, then I will check the palm, any palmar erythema, any Dupuytren's contracture.
No pulmonary erythema.
No, nothing. Then I will check the pulse. What is the rate, normal, equal or not?
Pulse is 76 and equal on both sides, but it's low volume.
It's low volume.
Yes.
Okay. Then I will check uh, blood pressure. I want to check the blood pressure.
No need.
No need. Then I will check the JVP. It is raised or not?
Not raised.
Not raised. Then I will check his eyes. I want to check the anemia, jaundice, as you told, nothing.
You checked in the beginning? No, normal. Nothing.
It's normal. And there's no cyanide.
No
Okay.
cyanosis.
Oh, then on inspection, I will also want to see any pulsation on the chest.
No pulsation.
No pulsation. Then I will check the apex beat, whether what is the position of the apex beat. It is
Apex
displaced.
beat. It's not displaced.
It's in
It's in
place.
the
And
fifth mid-clavicular line.
fifth medical line. And then I want to check his character of the. It is tapping, heaving, or thrusting.
It's heaving apex, sustained on your hand.
Sustained with my hand.
Yes.
And can I felt any thrill at the apex by my palm of the hand?
You could appreciate a thrill on the right second intercostal space.
Right second intercostal space, not in the
Yes.
apex. Not in the
Yes,
apex.
it's
Okay.
more in the right. Yes.
Then I want to check the any left parasternal heave or thrill,
No left parasternal heave.
and no thrill. Any, then I will go to the P2 area on the left side. I want to check the palpable P2,
Normal.
normal. Any thrill at this place?
No.
Okay. And on the right intercostal space, I want to check is as you told me, there is a thrill.
Yes.
Oh, okay, okay. Then I with my I want to auscultate the patient. Is there any murmur? And first I will start with the apex. Any murmur at
Oh,
the apex?
you heard this. Concentrate, please, doctor. Did you hear it, or you want me to repeat?
But I did not hear anything.
Okay, just 1 second. I will do something. Please, doctor, unmute Doctor. Okay. Again, Dr. Azhar, we will try this.
Sorry, I did not hear anything. I don't know.
Okay.
No. There may
If
be
you could not
problem
hear,
with my phone. Huh?
it's better to put a headphone. Maybe that's why.
Okay, okay. I will put this 1 minute. Maybe in
Okay, I will give 1 minute later.
yes, yes.
Ready? I will try one more time. If no,
Yeah.
forget about it.
Okay, okay. Please try.
You
I'm
are ready
ready.
now?
Ready. I'm ready.
Okay.
Yes, yes. I heard. I think it looks to me that this ejection systolic murmur. I think.
Yes, exactly. Ejection systolic murmur.
Okay. Then I want to see. I will check whether this murmur. I will check the carotid whether it is radiating to the carotid or not.
It's radiating to the carotid. Yes.
Okay. Then I will check the back of the chest to see there is any crackles or not.
No crepitation.
No crepitation. Then I will check the back of the sacrum, so back of the spine. I will check the sacrum and I want to see is there any pitting edema or not.
No beating. No sacral edema.
And also want to palpate the liver, whether there is any enlargement of the liver or not, congestion of the liver or not.
Okay. Normal.
Normal. Then I will go down to the legs to see any pitting edema of the leg.
Also, no beating edema. Okay.
Okay. I think we
So
completed
now
my.
finish 6 minutes, but yes, still 1 minute because we took some 1 minute in preparing the voice.
Yes.
So do you want to do anything else?
I think from my
You heard
side,
ejection.
I finished.
You heard
Huh?
you heard ejection. You heard ejection systolic murmur on the apex, and it was also present in the first aortic area and radiate to the carotid. Do you want to do?
Radiate to the.
Do you want to do another maneuver?
Uh, I just want to see if the patient sit forward and lean forward to rule out any regurgitant murmur of the aortic regurgitation in the
Yes, you
left
did not
side of
hear.
sternum.
Yes. Second aortic, you did not
Uh,
hear. You did not listen to.
yes,
Also, you have to take the stethoscope down, a phenomena called Galaverdine phenomena, to check if there is any associated mitral regurg. You have to go by your
uh,
stethoscope down. After the apex, go to the uh,
I will check
yes,
to the axilla.
to
I
the
will
axilla.
also go
If it is
axilla.
present,
Okay.
because systolic murmur on the apex, you cannot say this is 100% aortic stenosis only. Maybe associated with mitral regurg. How to differentiate? You have to check if it is radiated to the axilla. If it is present, so it's associated with mitral regurg. If no, so pure
Yes.
aortic stenosis. Other thing also you have to
Yes.
look for in the leg. You have to look for any scar. What is the scar in the leg?
Yes. Any harvesting scar, I want to see whether there is any it has been surgery for any coronary artery disease.
Yes, exactly. If you will present the case, how you will present now this patient?
Uh, I have a patient of Ahmed, 45 years. He is complaining of shortness of breath, and on examination, I just found that that this patient the pulse is low volume and on the on palpation, I only noticed that there is a apex bit is not displaced. It is heaving in character, and I also noticed a palpable thrill at the A2 area. And on auscultation, I found there is a ejection systolic murmur, and this murmur is radiating. to the carotid area. And I also auscultated the apex. There was also a murmur at the apex and I also checked on the axilla, but I could not find any murmur in the axilla. So based on these findings, my most likely diagnosis is patient is suffering from the aortic stenosis.
And the important negative you will mention? There is no signs of.
Yeah, yes, I could not find any signs of infective endocarditis in the form of supplemental hemorrhage or
No need to
genital
no,
lesions.
no need to mention.
Okay,
Just
okay.
only no signs of
Uh,
infective
uh,
endocarditis. And no,
and there are no signs of pulmonary hypertension. There are no
or heart
signs of
failure,
pulmonary hypertension.
or heart
Yes,
failure you already examined before, or AF also, because this is important negative. Okay. So if I
yes.
asked you what are the causes of aortic stenosis?
The causes of aortic stenosis most probably rheumatic disease, rheumatic heart disease, infective endocarditis, and then there may be also any bicuspid aortic valve or sclerotic aortic valve in elderly patients.
So you
And
can divide it congenital and acquired. Congenital like
yes,
bicuspid aortic valve. Acquired like
Gonna be
acquired like
different.
rheumatic heart disease,
yes,
infective endocarditis, and then there may be some condition, other Paget disease, alkaptonuria, like this. And
the
then in the
important, yes,
older
this
there
is
may be atherosclerotic,
calcification. Yes, this is
atherosclerotic
okay.
calcification in the old
So
age.
what are the differential diagnosis of aortic stenosis?
The most important differential diagnosis is aortic sclerosis. If there is aortic sclerosis, the murmur will not radiate it to the carotid. And the other
Excellent.
differential I can and the other differential it may be hook'em, but the hook'em also has ejection systolic murmur, but this murmur should be present on the left sternal edge, and it increase with standing and with salva and decrease with skating. And the other murmur, which I can say, there may be pulmonary stenosis murmur, but the pulmonary stenotic murmur will be on the left side in the second intercostal space. I can also put VST. VST murmur is also pansystolic. The murmur of VST is also pansystolic murmur, not the ejection systolic murmur, and it is also present on the left peristernal edge, not on the
Okay.
right intercostal space.
Excellent, Dr. Azhar. So any way to differentiate between the type of this valve lesion itself? I mean, it's supravalvular or valvular or subvalvular. Do you have any way to differentiate?
No, sorry, I don't
Okay.
have any idea.
Do you know supravalvular? This is a condition called Williams syndrome. There is characteristic facies by this. Okay. Subvalvular HOCM, as you already mentioned. Okay. This murmur will not radiate and it will be double apex beat and it will be increased by standing and valsalva and decreased by squatting. Okay. And the
Yes.
valvular, which you are in now, is aortic stenosis. So, what are the treatment of the aortic stenosis?
The treatment of the aortic stenosis is basically it is the we have to replace a valve. We will not repair this valve. In aortic
Okay.
stenosis, there are two ways. Either we can do percutaneous. If percutaneous, there will be no scar, and we can put the tissue valve, which we call TAVI. But the other option is surgical. In surgical, we can do the midline scar, and through midline scar, we can put the metallic valve or the tissue
So,
valve. But the tissue
do you know the indication for valve replacement by prosthetic valve replacement?
indications of prosthetic valve replacement.
Mm.
If the patient, y- yes, it depends upon the age of the patient. If the patient cannot tolerate the surgery, uh, uh, then we can go for the uh,
TAVI. Okay.
sorry, but TAVI. We will if the patient is not fit for the surgery, then we can go for the percutaneous TAVI.
Okay. And the other prosthetic itself, what is the indication?
Uh, prosthetic indication if the patient
uh, patient old age like this.
No, metallic valve. I mean, metallic valve replacement. What is the indication?
Meta,
You told me
uh,
there is
me-
no pharmacological medic treatment, as you mentioned. Okay, you can give only beta blocker if
yes,
the
yes,
patient has angina like this. But if the patient
yes,
now,
yes,
what are the indication? You have to do surgery for the patient.
yes, yes.
Mm. What
Uh, what else you want to ask? What else treatment?
what what are the indication for surgery? You told me the treatment for aortic
Uh-huh.
stenosis is
Yes. Indication of surgery. If the patient is symptomatic, then
yes.
severe aortic stenosis, then
Mm.
we will go for the surgery. And aortic valve area like less than 1 centimeter or
Yes.
gradient more than 50, we will go
Mm.
for the surgery. And if the patient is asymptomatic, if the patient is asymptomatic, then
Plus.
in that case, uh, if the patient valvular area is less than zero point 0.6 and
Mm.
left ventricular systolic dysfunction, it is showing gradient more than 40, and then abnormal BP response to exercise treadmill test.
Or one more, if the patient has attack of
Uh,
ventricular,
Tachycardia.
yes. And one else, if the patient will undergo CABG.
Cardiac
So already
surgery,
the patient,
cardiac surgery.
yes, the patient will
Because
undergo
in this
surgery.
way,
So yes, you will take it in your way, yani, and correct it. Last question:
yes,
what are the complication of aortic stenosis?
complications of the aortic stenosis. Uh,
Aortic
the
stenosis,
patient,
there will be no blood flow to originating from the left ventricle, okay, due to the stenotic valve. So there will be
there will be, if there's a back pressure, there will be left ventricular hypertrophy,
yes,
and
one of the complication. Mm.
there will be pulmonary hypertension,
No,
and there may
more
be,
more more important than pulmonary hypertension. It's very likely for unlikely for aortic stenosis to cause pulmonary hypertension, not like the other
yeah,
mitral stenosis and this valve. Sudden cardiac death. This is very first complication. Heart failure, one of the
no card,
complication. Yeah, arrhythmia also one of complication. Infective endocarditis, as you are searching for in your examination, and the manifestation, all manifestation of low cardiac output like syncopal attack, dyspnea, or angina. Okay, so you are
very
searching in your examination for infective endocarditis. Why? Because this is one of the complications. You are checking bilateral basal crepitation while you are doing examination because this is one of the complication. Okay, that's why when you are
yes,
mentioning, you will say important negative. It's not only just only a scheme you have to follow. No, because it's one of the complication of the aortic stenosis. Okay, doctor. Thank
yes,
you very much and well done. Very well done. I think you requested cardio before. I remember.
yes,
That's why I
yes, yes.
prepared this for you. So, very good, wallahi, Dr. Azar. Very good, mashallah. You
Thank you,
want
thank you.
any,
So
you want, mm,
yeah,
ask.
in the examination, in the exam, they can ask from us indication for surgery. So we should be thoroughly memorized. They can ask indication, like I told, severe aortic stenosis, aortic valve area less than 1 centimeter and gradient more than 50, and asymptomatic valve area less than 0.6 centimeter, ventricular tachycardia, and gradient more than 40. We should memorize it. Uh,
If
they
you,
may
if
ask
you,
in the exam.
yes, if you could memorize, okay. If you couldn't, I'm sure it will not affect. At least the examiner understood that you know the main treatment for aortic stenosis is surgery, and there is indication.
Sir.
One of them is severe. You will take, for example, very tight or very narrow valve or pressure gradient is high. Okay, and you will
Yes,
remember if the patient is asymptomatic or the patient will undergo CABG, you will do it. If the patient moderate or asymptomatic and plus has some abnormal BB changes or stenosis discovered in the E. coli like this is our indication. But if you remember the numbers, it will be very good. If you don't, what you will do? Don't try to overload yourself by information. Okay.
Thank you very much, Dr. Thank you very much.
Okay.
You boosted my confidence.
You will
Very
increase and you will
very
pass, I am sure. For me, I am sure you are good in the talkative stations like long and communication, and short you will manage easily. Just more and practice. Anyone else want to ask any questions? Okay,
sorry,
just
Dr. Talat, sorry, just for asking question. Regarding this cardiology examination in the short case, he just will tell me examine the heart, or he will be specified just examine aortic area or pulmonary area like this. It means the short case just examine the heart like this, or he will specify something in it like.
no. It will be in cardio, mostly it will be examine all the cardiovascular system. He will tell you, for example, the patient came with shortness of breath, examine his cardiovascular system. Okay. The
Okay.
patient came for shortness of breath, examine his chest also in chest. Okay. These areas, and this happen in Irish. In Irish, sometimes he give you, because in Irish there is some station are called miscellaneous, maybe endo, maybe rheumatology. So he will tell you examine as appropriate. For example, examine as appropriate will be in case of systemic sclerosis, in acromegaly. This is in Irish. But in basis, mostly he will tell you examine something. For example, one case, neuro, he will tell you examine cranial nerves or examine lower limb. This is the only, because neuro examination is very long. But cardiovascular chest abdomen will be all.
Okay. Okay. Thank you.
So I will, Dr. Ali there?
Yes sir, how are you دكتور؟
أهلين دكتور علي، كيفك؟ How are you؟
أهلا بك، حياكم الله، شلونك؟
الحمد لله. جاست ممكن دكتور علي بس نخلص الحالة الثانية شورت عشان
Okay.
just to finish recording short together, and I will do your long case recording alone. Okay.
اوكي نستفاد جميعا.
Okay. دكتورة سماح there.
ايوه موجودة.
Okay. يلا دكتورة سماح. دكتورة سماح Irish you told me right.
ايوه.
Okay. الإيرش. Okay. So as I told, in Irish there is examine as appropriate. Okay. There is one case. So I will now you enter the station and examine as appropriate. Okay. I will calculate 6 minutes for you also. يلا. Okay. Proceed دكتور.
يعني ما هتوريني صورة او كده ابدأ بيها ولا ابدأ طوالي بس
أديك
تديني
صورة.
الكلام؟
طيب أديك صورة.
ما the appropriate دي معناتها يا صورة يا تديني مثلا كلو عن
I will give you
examine the
one picture.
patient.
Try to speak in English because there's some non-Arabic. Okay.
Okay.
I will give you a picture. 1 second. Do you see the picture now?
ايوه.
Okay. Okay. يلا examine as appropriate. Are you there?
ايوه موجودة، اكيد حصل لي mental block.
ما فيش mental block.
Examination of the
This is a real case in Riyadh Center. This is a real case in Riyadh Center in short station. Okay.
yes, examination of clubbing لكن
In Irish,
I
this is a
don't
real
know
case.
about method.
No,
Okay.
no,
No
no.
problem.
Examine as appropriate doesn't mean okay. خلاص. Examine as appropriate doesn't
Okay.
mean that you have to examine
Okay.
only the finger. Examine all.
Yes. Enter the room. Raise the
Yes.
examiner
Okay.
and read the instruction and wash my hands or do disinfectant by alcohol, and then introduce myself to the patient and said for him, I am Dr. Hassan. I'm a candidate for exam today. I need to examine you. If you feel any pain or discomfort, please let me know. After that, take permission to expose his, take the shirt out. And after that, start examination by general look. Go 2 step back for general look for surrounding.
Okay, normal.
Look for what?
Nothing.
What you say?
Nothing. You
Okay,
did not
looking for
find anything.
surrounding. For
No, nothing is there.
okay. After that, start examination by look at the hand
This is the hand.
from the dorsal side. From the dorsal side, looking for any clubbing, for any
This
splinter hemorrhage, for any from inside, for any ulcer node, for any genuine lesion, for any pulmonary edema, and also
nothing.
do
I will tell you the
larynxedema.
finding, okay? Just you ask and I'll tell you the finding.
Okay. Okay. After that, examine those.
Normal pulse.
Mhm. Rate or rhythm of synchronicity. Okay. After that, check the blood pressure.
No
Normal
need.
also.
Yes.
Okay. AG, JVV, raise or
Normal.
not. Okay. I, well,
No pallor, no jaundice, no
mhm.
cyanosis.
Okay. No cyanosis. Okay. And then examine the chest. Any scar.
No scars.
Okay. Examine the chest for auscultation, percussion, palpation, any chest expansion also. Any finding in the chest?
Normal. What you are searching for in the chest? Or expect to
We are
find?
searching for, yes, expect finding sign of the chest and recording actually to exclude the BDA and exclude Isger syndrome in the pericardium. In the heart, exclude the lung cancer, severity of lung disease, and
Okay.
bronchiectasis. This all this was clubbing. Nothing positive.
All are normal.
Okay. Abdomen, nothing. Also, no
What you are
organomegaly, no
what you
mass,
are
no
searching for?
nothing.
No mass, no organomegaly.
For okay. Lower limb edema,
Also normal.
normal.
Mm.
Chest, nothing, no finding, no,
No,
no
no
wheeze,
finding.
no crepitation. Okay. Lower limb, nothing. I think
No.
this differential of actually this differential of clubbing. I think this familiar clubbing type is everything's negative. Maybe
Do you
familiar
want to check it? Do you want to check anything in the neck?
in the neck lymph nodes. أيوة.
Mm-mm.
Lymph
What else?
nodes and also
Mm.
complete a chest examination by tracheal tug, tracheal deviation, and
Something
external notch distance.
something
What?
important in the neck. Something important in the neck you have to examine.
Lymph nodes? No lymph
You
nodes.
mentioned. Do you need to examine the
Uh,
thyroid?
thyroid, yes. Thyroid also.
So, what are the causes of clubbing?
Uh, I said before, respiratory cause, severity of lung disease, bronchitis, cystic fibrosis, and lung cancer, maybe cardiac cause,
Like,
Eisenmenger and congenital heart, congenital lung disease, uh, Eisenmenger syndrome,
yeah, yes, what else?
and what else in the cardio? Uh, جيت أقول لك lung cancer, not cardio. Um,
What
I
else? Very
didn't
important.
remember صراحة.
Eisenmenger syndrome,
Um,
infective,
yes, already mentioned. Infective endocarditis.
and congenital
Mm.
cyanotic heart disease. Okay.
Yeah.
Okay.
Congenital,
But also
remembered, and is a major also remembered, but infective miss.
don't forget also to examine the two, because you may find the clubbing in his two. Okay. Especially in BDA,
Yes,
beta and ductal surgery.
differential
And
clubbing in BDA, yes.
what else causes in GIT?
In the GIT, also GI malignancy, and what else?
What else?
What else in the GIT? Chronic liver disease.
Okay. There is one very
Loss of
important and common in long stations.
اسمه شنو؟ carcinoid.
IBD. All malignancies, any malignancy you will mention, it will be it will be correct. All malignancies can cause clubbing. Okay. In GIT, the most
Okay.
important to mention, as you said, GIT malignancy. Okay, but you have to mention IBD because can cause primary biliary cirrhosis also, and bilharzal polyposis, and hepatocellular carcinoma, gastric carcinoma, pancreatic carcinoma. Any cancer can cause malignancy. Okay, and two
Okay.
important still you did not mention.
Yes, endocrine cause. There is اسمه شنو؟ thyroid acropathy.
Yes.
Maybe cystic fibrosis. Was this not
Cystic
endocrine?
fibrosis can cause
Yes.
clubbing because it can cause bronchiectasis. Exactly right. Excellent. Bronchiectasis, it's associated with the clubbing because this is one of the seborrheic lung syndrome. Bronchiectasis, emphysema, lung abscess, all of these can cause clubbing. COPD can cause clubbing.
Yes, can cause if associated with complicated by bronchiectasis or carcinoma.
Yes,
But
excellent.
itself not correct.
Yeah, excellent. So what else can be? You mentioned one in the beginning. So what is this case? What is your diagnosis for this case?
Familial also
Yes.
can cause familial.
Idiopathic and familial. And is inheritance?
Yes, genetic.
Autosomal?
ما مذكرة والله.
Autosomal dominant.
Autosomal dominant.
Yes, this is a real case, and Riyadh, you may face this case. Okay. So what is the investigation?
Will do basic investigation apart from complete blood count, RFT, LFT, electrolyte, ESR, reactive protein, and we'll do sputum culture and sputum.
So you are doing this
culture
investigation to search the cause, investigation for the cause.
Yes.
Yes, because there is no specific investigation. If it is idiopathic or familial, there is no specific investigation. And what is the treatment?
Yes, excludes the other also. Excludes the serious condition. Is the patient sick and any suspicion?
Treatment of the underlying cause. Just mention one word will cover all. Treatment of the underlying cause. If no underlying cause,
no need treatment.
Reassurance. Just reassure the patient this is a benign condition and it's familial and run in family, blah blah blah, and they just explanation.
Okay.
Last question. Do you know the grades of clubbing?
في 4 جريد. آخر واحد فيهم تقريبا درام ستيك تقريبا صح؟ بس ما متذكرة صراحة.
Drum stick or hypertrophic osteoarthropathy, there will be. I will share.
Stage 4
I will share picture to be more.
بحاول أذكرهم لكن.
This is a picture. Okay.
صراحة.
It's obvious now. Do you see this? No خلاص, no need دكتورة, just to if you want to take this screenshot. I think it's appear.
Okay, yes.
Nail fold will be obliterated. Okay. Then will be peaking like parrot. Okay. And lastly, there will be the increase in the lateral, which is drumstick, or you are saying hypertrophic osteoarthropathy. Okay. First grade, you cannot see. You can do only fluctuation test. fluctuation test. Okay, there will be increased fluctuation at the nail bed, a nail fold. Second grade, you can see
Yes.
by Shamroth sign. This window sign, you are putting his fingers like in front of each other. The window sign will be obliterated. You will know there is clubbing.
Obliteration.
3 and 4, it's obvious. From far away, you can see. Okay.
Yes.
This is a picture. If you want to take a screenshot to. Okay.
Okay.
So this is a real case in Riyadh Center came last year. Last year. Okay.
صراحة very bad
Any
case. Yeah, I
no,
have to
he
prepare
very easy case.
myself
Just
for
he
for
want you. No.
oh
Just he want
easy, but
from you
not okay.
in
I
in
think
in
cardiac
in.
case or
No. Unfortunately, for me, I see this is easy case because you are searching for something, but you do not find
no
it.
more
All
business.
will be normal. So you will not get difficulty in presenting your case. But just to know from the beginning, if you know the information that there is a familial clubbing or something called idiopathic clubbing, you are examining. You will examine chest examination quickly. You will examine cardiovascular examination, and you will examine for abdominal examination quickly. You will not go deep like the detailed citation for each of them. Do you want to ask any question?
No, please. Thank you.
Okay, anyone want to ask? Okay, I will stop the record here and I will do record again with the long case, Dr. Ali.